Hello, welcome back to the channel. Today we are talking about something that has raised concern among many South Africans and sparked debates around access to healthcare outside our borders. Reports have surfaced about a South African woman living in Nigeria who has developed a serious neck allergy but is struggling without access to free healthcare. It is a situation that has not only highlighted her personal struggle but also raised bigger questions about how South Africans living in other countries cope when they face medical emergencies. Please watch till the end so you can hear the sources of this news and try to verify it for yourself. And while you are here, don't forget to subscribe to the channel so you don't miss any of our updates on important events across South Africa and the region. Now let's dive in. According to reports, this South African woman, who is said to have relocated to Nigeria some time ago, recently developed a serious neck allergy that has caused pain and discomfort. What has made things worse for her is that unlike here in South Africa, where many rely on public hospitals and clinics that offer free or subsidized services, she has been left to struggle in Nigeria where healthcare is not free for foreigners. This situation has reportedly forced her into a very difficult position because she either has to find the money to pay for treatment privately or risk her condition getting worse. This news immediately raises the question many South Africans might be asking themselves: what happens when our people go to live or work in other African countries and suddenly find themselves in need of medical care? We often hear about foreigners in South Africa making use of our public health system, which has been a hot political debate for years, but the reality is that not every African country has the same setup as ours. In Nigeria, for example, healthcare is largely privatized, and even locals sometimes struggle with high costs. For a South African far away from home, the struggle becomes even heavier. Her case has drawn sympathy from South Africans who believe she deserves help, but at the same time it has sparked tough conversations. Some people are asking whether the South African government has any duty to step in when citizens abroad face such challenges, or whether it is up to the individual to make sure they can sustain themselves medically in whichever country they choose to live. Others have pointed out that many foreign nationals in South Africa often receive treatment here even when they cannot pay, which stretches our own health system, and they are questioning whether South Africans abroad receive the same courtesy. The woman's story is not just about one individual but touches on a bigger issue of cross-border healthcare and migration. For years, South Africa has been seen as a place where people from neighboring countries come to seek better opportunities and sometimes free health services. We have had debates in parliament, in hospitals, and even in communities about the pressure this puts on our system. Yet here we have the opposite case, a South African in another African country struggling because she does not have free access to healthcare. It's an uncomfortable reality that exposes a double standard. If foreigners in South Africa can access our health services, should South Africans abroad also be able to access free or subsidized care in those countries? The answer is not simple because healthcare systems vary. For instance, Nigeria's health sector has long been reported to be under strain, with shortages of medicine, limited public funding, and hospitals that rely heavily on private payments. In such a system, it is already difficult for many Nigerians to get affordable care, so the idea of extending free healthcare to foreigners may seem impossible. At the same time, the woman's case highlights the personal cost of being far away from home when medical issues arise. She reportedly has no immediate support system, no health insurance, and no backup plan, leaving her with limited options. This has become a wake-up call for many South Africans who travel or relocate to other countries without fully considering the healthcare structures there. It serves as a reminder that before moving abroad, one must think about health insurance and other forms of medical coverage, because things can change very quickly when sickness comes unexpectedly. The reaction from the public has been mixed. Some have expressed sympathy, saying no one deserves to suffer without medical attention, regardless of where they are. Others have said this is a harsh reality check, showing that life outside South Africa is not always greener and that healthcare challenges exist everywhere. A few have even suggested that this case might push the South African government to negotiate better healthcare agreements with other African states, especially since cross-border migration is increasing. But as much as this story is serious, it has also brought some lighter conversations. On social media, some users made jokes saying the woman might be missing our free clinics back home, while others suggested she would return to South Africa quicker than expected after experiencing the Nigerian healthcare system. While these jokes lighten the mood, they also underline the serious point: healthcare is something we often take for granted until we no longer have easy access to it. Looking at the broader picture, this news is yet another reminder of how uneven healthcare access is across the African continent. While South Africa, despite its challenges, still offers some level of public care, other countries are struggling with shortages of doctors, lack of medicine, and underfunded facilities. For an ordinary citizen, especially one far from home, this can mean the difference between life and death. It also raises the question of whether African governments should work more closely together to create agreements that allow citizens of different countries to at least get basic medical care when abroad. Something like a regional healthcare pact could help prevent situations like this from repeating themselves. After all, migration is a reality, and people will continue to move between African countries for work, study, or family reasons. Before we wrap up, it's important to note that while the woman's case is concerning, it is also a lesson for anyone planning to live abroad. Always check if you will have medical coverage, plan for emergencies, and never assume healthcare will be free like at home. Because when illness strikes, reality can hit very hard. Thank you for watching and listening till the end. Please don't forget to subscribe to the channel so you can stay updated on important news affecting South Africans both at home and abroad. And of course, a little light-hearted note to end off with: they say laughter is the best medicine, but in this case, I think our sister in Nigeria would rather take real medicine first, then laugh later. All images used are for illustration purposes only. Sources of this news include Daily Maverick, News 24, and Times Live.